So how are breathing systems classified? Just like vaporizers being classified based on several features, we have to classify breathing systems also.
Open, semi-open, semi-closed, closed, sir.
Semi-closed, closed. Okay, a different method.
With CO2 absorbent, without
Without
CO2
CO2 absorption.
absorbent.
Very good. Okay, so they are classified according to their function as well as the equipment that are used. Okay, that is the basic system, the method of how you do that. And a few examples. So many people have done the classification. The commonest what you have said is open, semi-open, semi-closed. First introduced by three people called Drips, Vandam, and Eckenhoff. Okay, they are all people who worked in South Africa. They were the people to give this description. Then Moyer's classification, he borrowed, he removed that insufflation from that. And then what is the difference between insufflation and open drop method? Any idea? When will you say that you are giving insufflation anesthesia?
No, sir.
Insufflation means you are constantly supplying the gases through a nasal cannula or a catheter. Okay, and through that, if you give the anesthetic agent, that is called insufflation. Just like your apneic insufflation technique to prolong the safe apnea time, where you are putting an oxygen nasal cannula after pre-oxygenation and then paralyzing the patient, and you are taking the time to intubate. Constant flow of oxygen will be going through the cannula. So that is called the apneic insufflation technique. Patient is not breathing, but this insufflation will make the gases go forward, and whereas in a spontaneously breathing patient, to maintain continuous anesthesia instead of the hazard of pouring on and off the liquid, he used insufflation technique also. And there was a person called Collins who also did the same thing. Then Adriani, he said open vaporization, insufflation, semi-closed and closed. Then there was a Convoy classification where he said open, semi-open, closed, semi-closed with rebreathing, semi-closed with absorption, semi-closed with non-rebreathing. Similarly, there are several things. If you see Dorsch and Dorsch book, there are about 10 classifications given, but just for exam sake, remember a few names like this. So what factors were taken into consideration in these classifications? In other words, if you know the rebreathing, okay. The factors taken into the presence or absence of a reservoir bag or a rebreathing of the gases, exhaled gases, absorber to remove carbon dioxide, whether it is present or not, and direction of the valves, whether there is a unidirectional or bidirectional valve. Okay, these are the four factors which are taken into consideration for classification: reservoir bag, presence of rebreathing or absence of rebreathing, presence of CO2 absorber or absence, direction of the valves. So how does the classification based on equipment differ from that based on the function? The first classification is based on the functional status of the breathing system. Whereas the equipment classification considered two things. One is how much of fresh gas flow you are using and what equipment you are using to deliver that. Okay, so this is the basis for the second classification. 2 liters of fresh gas flow in a circle system. That means this is the, or you are using 5 liters, 6 liters of fresh gas flow in a spontaneously breathing system, in a McGill system. That is the equipment classification. And this was proposed by one Dr. Hamilton. Okay, so this is the first thing that you have to know. What is the fresh gas flow required for spontaneous and controlled ventilation in different breathing circuits? This is a important point that all of you should know for both exam as well as your practical application. You have different systems of breathing system. what should be the fresh gas flow for all of you know that you are using Mapleson A, B, C, D, E, F circle system. For all these things, what is the different fresh gas flow? Roughly,
Map
is it based on
2 to
tidal
3
volume
times
or
the
minute ventilation?
2 to 3 times the minute ventilations.
Yes. So you have this Mapleson classification, for which Mapleson A, for spontaneous respiration you require 70 to 80 ml per kg per minute. Whereas for controlled ventilation, this circuit, is it ideal for controlled ventilation or not?
It is for
No, sir.
spontaneous, ideal for spontaneous.
Ideal only for spontaneous. So you can see you have to use 2.5 times the minute ventilation, which means 12 to 15 liters of fresh gas flow you have to use. So that is a waste of gases, as well as it is not efficient also. On the contrary, if you see the Mapleson D, you require 2 times the minute ventilation for spontaneous, whereas you require only 70 ml per kg per minute for controlled ventilation. So that is why it is given in green. For controlled ventilation, Mapleson D or Bain circuit is very good. For spontaneous ventilation, Mapleson A is very good. And both of them require only 70 ml per kg per minute for spontaneous in Mapleson and for controlled in Mapleson D, Mapleson A and D. Okay. Identify the two breathing circuits. Which one is suited for spontaneous? Which one is suited for controlled ventilation? What is the top one? We have given clue here as to where the APL valve is situated.
Mapleson A, sir. First picture.
Mapleson A.
Lax.
A lax circuit.
Lax circuit, sir.
Lax circuit. What type of lax circuit?
Coaxial Mapleson A.
Is it coaxial? That means one tube should be
Oh,
inside
no,
the
okay,
other
sir.
tube.
Parallel. Yes, sir.
This is called parallel lax circuit, suited for spontaneous ventilation. This is called parallel Bain circuit, suited for controlled ventilation. Okay. So in Bain circuit, you have the valve in the inspiratory limb, whereas in LAC you have the valve in the expiratory limb. Okay. So that is why it is suited for that. What is shown here? Why knowledge of various systems is important to anesthetists.
Is the types of
Different types of Mapleson systems.
The entire Mapleson classification comprises of which particular breathing system? Semi-open or semi-closed or
semi-open,
closed? Semi-closed. There
semi-closed.
are different types of semi-closed breathing systems classified by Professor Mapleson. And the knowledge about their function is important for choosing the right system for spontaneous or controlled ventilation. Okay. What is shown here?
The position of
Components,
APL
very good. This
components.
shows the arrangement of the components of different Mapleson breathing systems. Okay. So
Yes, sir.
Mapleson A, location of fresh gas flow is near. So these are the things which you have to know. Okay, where is the fresh gas flow? Where is the expiratory valve? Where is the reservoir bag? How much is the corrugated tubing? Whether it is present or absent? Examples and comment. What are all the types that you come under that? So for A, it is McGill and Lack. For B, it is not used anymore. For C, it is also not used, but it is also now ambu bag is considered as Mapleson C, and the older method of Waters to and fro canister is also considered under Mapleson C. And D, all of you know, is Bain circuit, and E is ISTPs, and F is Jackson-Rees modification. Okay. What is shown here? Hmm?
It is Bain circuit, coaxial system of Mapleson and D's.
Gas is flowing here through the inner tube. Bain, do you get the gas flowing outward or inward coming to the patient? You
It
have
will
to
go
watch.
towards the patient, sir.
Eh?
It will go towards the patient.
See, patient is here. By Bain, it has to go towards the patient. Inner tube is the delivery inspiratory limb.
Yes, sir.
Whereas here it is the arrow is showing the gas is going out. Fresh gas flow is coming here.
Lax
lax, sir.
coaxial system.
This is a coaxial lag. Somebody mentioned coaxial earlier. That was parallel coaxial. I mean lag circuit. This is coaxial lag circuit. Okay. And this is the parallel lag circuit which you see. Okay. Just for comparison sake. So what is an afferent reservoir breathing system? Give examples and fresh gas flow needed to prevent rebreathing. What do you mean by afferent reservoir breathing system? When will you call something afferent and efferent? Going away, going towards, isn't it afferent, efferent? Huh? Afferent limb is that part of the breathing system which delivers the fresh gas flow from the machine to the patient. If the reservoir is placed in this limb, they are called afferent reservoir. That is, if the rebreathing bag or the reservoir bag is kept in the tube which is delivering the fresh gas flow to the patient, it is called the afferent reservoir breathing system. Okay. The examples are Mapleson A. You can see the McGill's or lag flowing, fresh gas flow is coming here, reservoir bag is here, corrugated tube is here, then there is a expiratory valve going to the patient. And the volume of fresh gas flow to prevent rebreathing is 0.8 to 1 or 1 time the minute ventilation. Okay. So equal to minute ventilation or slightly less than that if you use during spontaneous respiration, patient will not have any rebreathing. The second is again, if Mapleson B, which is not used, reservoir bag is there, then there is a corrugated tube, fresh gas flow is there, and then it comes to patient, and it requires 1.5 to 2 times the minute ventilation to prevent rebreathing. And C, this is the water's to and fro canister, where again fresh gas flow, reservoir is placed in that, and this is going, again it requires 1.5 to 2 times the minute ventilation for. What is efferent reservoir? So if you know that if the reservoir bag is in the inspiratory limb delivering the fresh gas flow, it is afferent reservoir. Whereas efferent reservoir, it should be the opposite.
EF, sir.
Okay.
It
So
vented
this
out
is
to
the part of breathing. It carries expired gas from the patient and vents to the atmosphere through the expiratory valve or port. If the reservoir is placed in this limb, they are called efferent reservoir. And the other three systems are the efferent reservoirs. For example, the Bain circuit, the ISTPs, and the Rees, the Jackson-Rees modification. They are all, the reservoir is situated. You can see the fresh gas flow entering very close to the patient in all these things. So the reservoir bag is in the expiratory limb. Okay. So that is the difference between afferent and efferent reservoir system, which is a common question they will ask you in the exam. So instead of asking them for Mapleson A, B, C, they can ask you in this way also. To classify the Maplesons can be classified into afferent reservoir system and efferent reservoir system. Now identify this breathing system. So this is a little bit difficult. I wouldn't say it will be easy for all of you, but at least try to attempt to see what are all the, at least tell me the parts, what are all the parts. This is the patient end. Agreed?
Yes,
Yes,
sir.
sir.
What is this?
APL valve
APL valve. And this is the corrugated tubing.
corrugated
Okay.
tubes.
And this is a fresh gas
Expiratory
flow, and this is a thing which is going. Then there is a bag which is
It's a bag.
enclosed into that. Okay. So most of you would not have known. This is called enclosed afferent reservoir system. Okay. This was introduced the Mapleson A system enclosed in a non-distensible container with a coaxial corrugated tube whose expirated limb is attached to the bottle. The modification of the above by the expirated limb into the opening bottle, and advantage of this system is supposed to be, it was introduced by Miller, two Millers, W.D. Miller and J.C. Miller, and they found that using this sort of system, they are able to eliminate the alveolar gas, which contains most of the carbon dioxide, much better than the simple Mapleson system A. Okay? The D.M. Miller and J.C. Miller are the two people who introduced. What is the importance of fresh gas flow?
To
Why
prevent
we are
rebreathing,
giving
sir.
importance to fresh gas flow? So many times of minute ventilation or so many ml per kg per minute. What is the importance? What are the things fresh gas flow will decide? It's a very simple question. You have to know the answer. Okay, fresh gas flow will result in low fresh gas flow will result in carbon dioxide retention. High fresh gas flow causes wastage of gases. Optimal fresh gas flow avoids both these problems. So this is the picture to remember easily. Low fresh gas flow, CO2 retention. High fresh gas flow, wastage and theater pollution and phosphoric pollution. Optimal, given in green color, will prevent these two complications. What is apparatus dead space and how is it measured?
So it is from the Y limb up to
Hmm.
the end of the ET tube.
That is if you are using circle system, isn't it?
Yes, sir.
If you are using McGill's, if you are using ISTPs, or if you are using Bain circuit. First of all, what is apparatus dead space? What is a dead space?
It's
does
just
not
creation
involve in gas
system, it's not the
Gas
gas.
exchange. So the dead space that is created by the apparatus is called apparatus dead space, which is not anything. Okay, defined as a dead space resulting from devices placed between the endotracheal tube and the breathing circuit, and is the primary source of dead space control, which can be altered by the clinician. Whereas anatomical and physiological dead space, we cannot alter them. Whereas apparatus dead space, we can alter them, which we will be seeing sooner. So it is measured at the level of the expiratory valve in afferent circuit, at the level of fresh gas inlet in efferent reservoir system, and at the junction of YPs in circle system. Okay, I'll show you the pictures how they will be measured. So if it is an afferent reservoir where the reservoir bag is in the inspiratory limb delivering the fresh gas flow, it will be calculated from the expiratory valve to the endotracheal tube or face mask. Okay. If it is an efferent, that is a Mapleson D, E, and F, where the reservoir bag, earlier picture I showed you, where the reservoir bag, which is an efferent reservoir system, it is at the point of entry of fresh gas flow. This is the location of apparatus dead space. And if it is a circle system, this is the location of dead space. So if you are able to cut down this connection, or some people use a elbow connect, like a right angle connector, all those things will increase the dead space. If you use a straight connector, it will occupy less volume. So that is how the dead space volume is calculated. So what factors alter the apparatus dead space? So it can increase in mechanical ventilation by using a large non-invasive mask or a big HME. So if you are going to use a heat moisture exchanger, which is having multiple layers and a large size, they all can increase the mechanical dead space, apparatus dead space. And by using an ET tube or a patient having a tracheostomy, the apparatus dead space can be reduced. So what is the apparatus dead space calculated in Bain circuit? Where is the apparatus dead space calculated in Bain circuit? What will happen if the inner tube is broken? Bain, is it an afferent system or an efferent system? Reservoir
Efferent
system.
Efferent,
system.
sir.
Efferent system. So where should be the dead space?
From fresh gas flow to the
Fresh gas flow, where is it delivered?
Inner tube, sir.
is at the end.
Inner tube,
inner
almost close to the electrical tube or to the waste mask, whichever you are using, isn't it? So
Yes,
that
sir.
is the point of, so it is calculated at the point of delivery of fresh gas flow, which is close to the patient. So it has the least or very minimal dead space, apparatus dead space is Bain circuit. Okay, and you can see this picture. This is an efferent reservoir system. So you have this inner tube is delivering the fresh gas flow, and the reservoir bag is in the outer expiratory limb. So it is called efferent reservoir system. And you can see the fresh gas is being delivered osmosis to the endotracheal tube or to the face mask. So this only this much, just like this picture. Okay. And what will happen if this tube is broken? Supposing
Dead space will
damage.
increase. Sir.
Huh?
Dead space will increase.
Dead space, entire thing will become a dead space. The entire volume of the expiratory limb will become a dead space. Okay. The patient will have a lot of rebreathing and he will be wasting his ventilation. Okay. So if the inner tube is broken, the whole corrugated tube becomes the dead space and that will interfere with the ventilation. Okay. Next again comes a museum specimen. Are you able to identify this?
Water circuit, sir.
What is to
Water's to and fro system. Classic example of bidirectional breathing system with a canister to absorb carbon dioxide. Under which class of Mapleson this equipment comes? Already I have
Mapleson
told it.
Mapleson
C.
C.
It comes under Mapleson C system. Identify the equipment and name the parts or the components.
Ambu bag.
Ambu bag, very good. It is called Ambu bag. What is the expansion for Ambu?
Artificial manual breathing.
Breathing
Unit.
unit.
Very good. Bursting laugh, very good. Air mask bag unit also is another name. And earlier, because it was used in ambulance, somebody said it is the ambu from the ambulance. First 4 letters of the word ambulance was taken, but later on it was modified as artificial manual breathing unit or air mask bag unit. What are all the parts of this which have been marked there with the arrows? If you learn the Arabic line, you can easily sell. What is this?
Face mask.
Transparent face mask.
Transparent face mask.
Transparent face mask. Then
Pressure releasing.
pressure release
valve
valve
expiration.
or a unidirectional valve.
Unidirectional.
This is the expelling valve. This is the unidirectional valve. The red thing is there. That is the PEEP valve. What is this?
Self-inflating bag.
Self-inflating bag. Very good. What is this green tube? Where will you use the green color tube?
O2. Sir. O2
O2 delivery. Correct. It's an international coding for that. O2 delivery tube should have green color. And what is this?
fish mouth valve.
This is another valve here for releasing excess pressure. What is this?
Reservoir bag.
Reservoir valve. Okay. So this is the face mask. This is the expiratory valve. This is the PEEP valve. This is the pop-off valve. This is a self-inflating bag. Air inlet with one-way valve and oxygen reservoir socket. This is a oxygen inlet tube. air inlet and pressure release valve and throw air back. Okay, so these are all the things that are there. What are displayed here?
Bain circuit, sir. Bain circuit.
Bain circuit.
Circuit.
It's for adult or children?
Adults.
Adult, sir.
It's an adult Bain circuit. What is this?
Pediatric Bain circuit.
It's a smaller version, pediatric Bain circuit. What are the dimensions of Bain circuit? Normal and one used in MRI. So,
3 to 5 times adult Bain circuit, sir.
Is 1.5 meters, sir. For MRI, 5
1.5.
times.
Five
what is
times.
the normal dimension? What is the length of the Bain tube?
Length
180
1.5 meters, sir.
5.4 meters for MRI. Normal is 1.6. Both have a 22 mm outer corrugated tube, 6 mm inner green PVC tube of the same length. Okay. What are the indications for uses of pediatric Bain circuit? When will we use it?
MRI.
Controlled vent.
MRI suit. Then anything else other than MRI? Endoscopy and MRI. Okay, both you can use. Identify the circuit shown here. What are its hazards?
Jackson-Rees circuit.
Jackson-Rees, sir.
This modification of IRSPPs. Very good. What are the hazards and advantages and disadvantages?
Advantages, both spontaneous and controlled ventilation, sir.
Very good. It can be used for
It
both.
has no valve, sir. So we only have to.
So no resistance.
Cannot be
Lightweight, portable. Okay, and it has no valve, so no resistance, and it can be used for both control and spontaneous ventilation. These are the three advantages. What are the disadvantages? These are the advantages.
delivered
Minimum-
cannot control.
Requires high flow rate, prevent rebreathing and air dilution. So all the problems are because of that: wastage of gases, pollution of the environment, it is not economical, and drying of the respiratory tract. All these things will happen because of the high flow rate. Because this is an old metal type ISTPs. What is this bag?
Kun bags.
Spoon bag, correct. So instead of earlier, when you want to do control ventilation, they used to pinch this open tail and squeeze the bag. And that was more cumbersome. So somebody said, why not have a hole here? This will also avoid using any valves in the circuit. So you can just close this valve and squeeze, hole and squeeze to ventilate. So more for easy control ventilation, somebody designed this with a hole in the center. So this is called the Kun bag. These are different types of T pieces.
Type.
So they are called the classic, modified, Washington, and normal. Now we are moving on to some of the equipments from the breathing system. Okay. Identify and name the parts.
Handle, sir. Hook,
Hinge,
flange, tip, sir.
tongue and spatula, then
Beaker,
tip.
tip.
Right. So it is first identify it is a Macintosh curved blade for adult use. Okay. So this is the handle. This is the hook on base. Usually earlier it used to be a screw type. Nowadays it comes with a hook on type. And there is a tongue spatula. Then there is a big tip. Why this tip is made rounded and big?
So it
Provide
does not
direct injury
damage the
To prevent trauma. Okay. So it will not injure. And it's a vertical step and all that. What is shown here?
Macintosh
Macintosh and
Miller-
Miller's blade.
Miller's.
There has been a
Wait.
different sizes.
Even if you don't know the name, you can say curved and straight blades of different sizes with the handle. Okay, different sizes of curved and straight blade laryngoscope with handle. What is the difference in using a straight blade and a curved blade?
A straight blade will include the epiglottis while lifting, sir.
Very good. Curved blade?
Curved blade, we have to keep the tip of the blade in the vallicula and lift.
Excellent, excellent. Curved blade tip is placed in the vallicula before the epiglottis. While using straight blade, epiglottis is included and lifted to see the glottis. And where do you use the straight blade?
In children, sir.
Pediatric patients.
Infant and children.
Pediatric.
Neonates, usually infants and neonates, okay, where their epiglottis is floppy and omega shaped. Okay, so there you can use it for children. What is
McCoy
shown
blades.
here and what is the advantage of using this?
Blade.
McCoy blade,
McCoy
sir.
blade
McCoy
is the difficult
laryngoscope. Very
airway.
good. Okay, what is the advantage?
It's a bit difficult.
We compress the epiglottis and will lift the handle.
Okay. So in what way it is
In difficult.
advantageous?
The tip is mobile, sir, in this.
So by lifting and folding the epiglottis, it helps to seeing the glottis without the need for external pressure or burp maneuver, backward, upward, rightward pressure. Usually we require some help when you are not able to see the glottis. But you have the McCoy, you can easily do it yourself without the need for any external assistance. Okay, that is the biggest. So these are all various things. This I will show you. What is the bottom picture showing now? The top one is the rigid ventilating bronchoscope. Below that, I have not put the name now. What is it being shown there?
Rigid bronchoscope, jet
Rigid
ventilation.
Huh?
Jet ventilation.
Jet ventilation. Is this the jet ventilation?
With ventilation.
Normal breathing, sir.
It is a normal breathing system which is attached to that. Okay. So this is the rigid bronchoscope to which you can use your normal breathing circuit. What is this?
Jet ventilation.
This is the jet ventilation. You
This
can see
is
the
just
needle
vent.
going there. So this is the jet Sanders jet which is there. So Sanders jet ventilator. This is the Manojet, which is another version to control the pressure. You have the toggle handle here, which you can use to assist that. And what is shown here?
Color-coded
Oropharyngeal airway.
Oral airway. Oral airway. Okay. What are these?
Nasopharyngeal airway.
Various sizes of nasal airway. Okay. How to measure the size of the oral or nasal airway?
From the
For
tragus,
oral airway, from the angle of the mouth to the tragus. For the nasal, from the ala of the nose to the tragus.
Okay.
So from oral airway, corner of the
Oral.
mouth to angle of
Angle of
mandible.
Nasal. Okay, that's how we measure for the length. This is the ovosapien airway. Where is it used?
Endoscopies.
Fiber
fiber optic
Fiber
intubation.
optic
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 intubation.
intubation. Very good. So you can use this like this. So Bergman airway for fiber optic intubation. So both these things, how they are used for intubation is also shown here. Okay. What are these?
Suction.
Color-coded.
Color-coded, different size of color.
Plastic suction catheters.
Suction
And
catheters.
this is the color coding with the size. Commonly, which size do you use?
Double the time of ET tube to.
Double the?
So
No, out of this,
14
which is the
views.
common
14.
14.
14, sir.
12, 10 to 12. Okay. What is this? Suction with the control, some control. Okay. So this is the special control with tap. What is this?
Closed.
Anchor suction. Okay. Yeah. What is this?
Closed suction system.
Closed suction.
Control suction. Yeah, very good. Okay. What is this?
Color
Different
code
size of
or
glasses.
Transparent
face mask.
scented mask, disposable, single-use mask, supposed to be single-use, but we are using it again and again. Okay, what is this?
Anti-static
Masks.
rubber.
It's a old
Plastic.
type rubber, black rubber anatomical mask. What is this tube and cap meant for?
ventilation port.
Huh?
Ventilation, sir.
Ventilation. How do you ventilate through this? See, see this portion. It is connected
Negative,
to that.
negative.
No, you can inflate air to fit in people with no dentures to increase the size for fitting. Okay, so you can remove the cap, attach a syringe, inflate it with air, and then cap it again, and use it in case you get an edentulous patient with a sunken cheek, and the mask is not fitting well. You can use that. What is this metal projections there for?
For holding the straps.
Holding the straps, okay, head strap or the, so black rubber anatomical face mask. What are these things? This is again very old museum specimen, just
Period.
for the exam sake, in case they ask you to identify. This is called Rendell-Baker-Sussex mask. Okay, Rendell-Baker-Sussex mask for pediatric use. And what is this tube? This mask for?
For endoscopy, sir.
This is transparent face mask for scopy. Okay, so you can use it for scopy along with that. And what is this mask for?
For non
Mask, sir.
MIB mask, sir.
Okay, CPAP mask, very good. And what is this? This is the one which can be used with this. So this is called the harness. Okay, so you can, this portion will go to the occipital area, and these straps you can insert into this metal and leave the mask on the patient's face without straining your hand for a long time holding the mask. All Westerners, UK, this is very commonly used. They will use this mask and allow the patient to breathe spontaneously with an inhalation. In the olden days, and they will go for their coffee. A harness to hold the mask. This is adjustable venturi mask which you are seeing. What are all these things?
Bamboo bag. CPAP mask,
non-breathing
nasal
mask.
prongs.
Bamboo bag with or without reservoir bag. Yeah. And I mean, there's a face mask with a reservoir bag, bamboo bag. Then what is this?
Hyperbaric.
Prongs.
Hyperbaric chamber. Then
Hudson mask, sir.
Hudson mask. Okay, so bamboo bag, CPAP mask, nasal prongs on the top row. Face mask with reservoir, hyperbaric chamber, and Hudson mask. What is this?
HFNO, sir.
High-flow nasal oxygen.
High flow nasal oxygen machine. Very good. What is this?
Oxygen concentrators.
Concentrator. COVID 3 years ஆயிடுச்சு மறந்துருச்சு எல்லாருக்கும். It was seen in every house, oxygen concentrator. Okay. So what is this?
Breathing.
Breathing.
Mask.
NRBM. Non-breathing breathing mask. Okay. Color coded final needles. Okay. Various types of tips. Okay. Can you identify that? Because their names are written there. Pinky, Sporette, Whittaker, and
Whittaker. Green name.
what is this?
CSC kits, sir.
CSC.
CSC center. Okay. This is
2 guys needed.
Toy needle.
Tohi graduated needle. Tohi needle with graduations. And this is used for post-op pain relief.
So this is
Patient control.
similar to the
Elast-
Baxter support.
Elastomeric pump. Okay, elastomeric infusion pump used for post-operative pain relief to connect it to the epidural that you are giving. Okay. What is this?
Peripheral nerve
Peripheral nerve
stimulators.
stimulators.
Peripheral nerve stimulator or maximum
NMJ.
Neuro.
sit for NMJ?
Yes, sir. The
Patient.
answer is
Oh,
I.
peripheral nerve stimulator.
Nerve stimulator for block. Okay, so this is not peripheral nerve stimulator for nerve block. The maximum current you get is only 5 milliamperes, and you can reduce it up to 0.1 or 0.2 milliamperes to identify the nearest placement of the needle. Whereas the nerve stimulator that you use for your neuromuscular junction monitoring, what is the minimum current that is delivered? 10 milliamperes. It starts with 10 and goes up to
50 milliamperes.
80. Okay. So what is chronaxy and Rio base? When you are going to use this nerve stimulator for blocking a nerve, you must know these two terminologies and their meaning. Chronaxy and Rio base.
Rio base is the current used to produce response to stimuli. Chronaxy is double the times of Rio base.
Time and strength. Okay. So what is seen here? This is the
Peripheral neuromuscular.
neuromuscular monitoring. You can see 40 milliamperes is the strength that is shown here. CNS for monitoring neuromuscular junction. How is it different from the level? Because of the various strength of the current. Okay. This is another type of neuromuscular monitor. Can this be used for nerve block?
No.
You cannot, because it is deliver a very high current. Again, this is we start only with 10 milliamperes, so you cannot use it. Okay. So, what is this?
Pulse oximeter.
Pulse oximeters.
Pulse oximeter with what are all the features that you are seeing? What is
Two
Massimo?
Statue.
First, the top portion is written as Massimo. What does that word mean?
The institute that made this
It is not any.
Massimo pulse oximeter.
It is an institute or the company which invented this technology. What is the technology that they incorporated compared to the earlier pulse oximeters?
It is pulse index.
Pulse index.
Photoplex.
There's got pleth variability index.
Pulse variability index is present even earlier also it was present, but it eliminated some of the causes like
Motion
light,
artifact.
ambient light, the position artifact, and then temperature artifact. All these things are removed. Okay, so what is in this is a finger probe for pulse oximeter. It displays SpO2, that is oxygen saturation, plethysmographic tracing, heart rate, battery charge, Bluetooth connection, and then the respiratory rate from plethysmograph, then pleth variability index, then perfusion index. What is pleth variability index and what is it used for?
Used to assess the fluid responsiveness.
Strength of the peripheral circulation. Helps to assess the strength of peripheral circulation. What is Massimo? Of course, it is a name of American company making non-invasive monitoring equipment. They use the signal extraction technology. That is what they are using to remove artifacts of motion-induced changes. Okay. Just the equipments and breathing circuits and vaporizers. So all Risha's requests have been fulfilled to some extent. Okay, Risha?
Yes, sir.